I'll introduce our esteemed speaker and take the session forward. Thank you, and I wish everyone an enjoyable and informative session.
Thank you,
Thank
Asavari.
you.
Good afternoon to all. So, today's topic is nuclear medicine and it will be presented by Dr. Mahendra More. So, it is my pleasure to welcome Mahendra More, sir, an accomplished medical physicist with extensive experience in radiation oncology as well as in nuclear medicine. Currently, Dr. More is working in Apollo Hospital, Navi Mumbai, as head medical physicist and RSO. Throughout his career, he has been actively involved in clinical practice, research, academic training, and adoption of emerging technologies in oncology. He is also NABL technical assessor for testing and calibration laboratories. Please join me in warmly welcoming Dr. More, and we look forward to gain valuable insight from his presentation on nuclear medicine. Over to you, Dr. More.
Yeah, thank you. Thank you for nice introduction, ma'am. And we'll begin with the session for nuclear medicine. And minute, I will share my screen. Is it visible to everybody?
Yes,
Yes,
it's
sir.
Yes, sir.
visible.
Yes, sir.
Yeah, in presentation, yes. So good afternoon again. So today's topic is the nuclear medicine and its diagnostic features and therapeutic features. So yeah. So the two machines were nowadays in a radiotherapy, along with radiotherapy, the nuclear medicine is also part of where the PET CT is installed and the same PET CT is being used for as a CT simulator. So you most of the centers are having these features nowadays. So we are using a PET CT a part of as a CT simulator as well also. So those centers who are using having PET CT and SPECT, these two machines you will be observing in those two centers. So the contents of these presentations, like we'll discuss what is nuclear medicine, why it is being used for diagnostic and therapy purpose, what is basic radioactivity features which we are using, what is the gamma camera, what for it is being used, what are the different isotopes which are being used in nuclear medicine, what is SPECT, the nuclear medicine, what is SPECT nuclear medicine studies are available, what a PET CT imaging is, how is it is being useful for in oncology as well and for routine diagnostic purpose. What are the therapy or isotopes used in therapy? What precautions we take in therapy? That way, we'll proceed with this lecture. So image what you see on the screen is a anterior and posterior view of the bone scan. So that was the earlier before PET CT come in picture. So earlier these types of images we used to get on a bone scan, and we used to say that okay, here there could be metastasis, and we need to go for a radiation therapy for prostate cases, for breast cases, whenever there is a bone metastasis. But these are picked up very later stage of the disease. Nowadays, the PET CT can pick up these at a very early stage, and we can target those by radiotherapy. So, as an introduction, a gamma camera is a medical imaging equipment basically used in nuclear medicine. It detects gamma rays. So, gamma camera. So, camera is to get the image, and gamma is from the gamma photons we get those images. So, gamma rays are emitted from the radioactive tracers which are inside the body. So, basically, in nuclear medicine, all the radio tracers are being administered to the patient. So, patient itself emits the gamma photons, and those are being imaged by the gamma camera, and it is used not only for this anatomical imaging. It's a functional imaging. It is called as functional imaging. Now if you see the image, it is basically the heart, the spectral scan of the heart. So heart myocardial, whether it is functioning or not, so that we are able to detect with the gamma camera. Either it can be single head gamma camera or dual head gamma camera. It has a functioning diagnostic capability of thyroid, of kidney. Okay, on sonography or on a basic X-ray, you will be able to get the idea of the kidney, what is the shape and size, but what is the function of the kidney that we are interested in, whether both the kidneys are properly functioning, whether one kidney is functioning less or more. So that way we can discuss or we can quantify the functional status of the organ, not only of the thyroid, it can be kidney, it can be heart as well. Even liver also can be studied with the your liver and lung organ also are being studied. Functional status of those organs can be studied under gamma camera. So it uses radioactivity or the isotopes for a diagnostic and therapy purpose. These substances consist of the radiopharmaceutical. So radiopharmaceutical is a separate can be separated from radioisotope and radiopharmaceutical. So when both are combined, it becomes a radiopharmaceutical when the isotope is combined with the pharmaceutical part. And in diagnostic, radioactive substances are administered to the patient, and the radiation emitted is measured uh, as it is located to that particular organ. And in therapy, we give isotopes by some means, by mostly by oral means. Then it is the treatment condition. Like in thyroid, we give radioiodine therapy. So 131 iodine is being administered, and that localizes to the thyroid gland, and the beta component of that iodine is mainly responsible for the treatment purpose. It delivers very high dose to the thyroid gland. Okay. Basic workflow in gamma camera or the nuclear medicine is the patient is injected with radio tracer. So radio tracer are various radio tracers are available nowadays. Earlier it used to be only technetium and different pharmaceutical, but now many tracers are available for PET CT and SPECT as well. The tracer emits gamma rays and the pharmaceutical parts plays a role. It localizes to the organ of interest. Like suppose if you want to image the kidney, then we prepare a medicine or prepare a pharmaceutical which will be tagged with the isotope technetium-99m and the DTPA or DMSA. These are the two label pharmaceuticals are available. So they will localize to only kidney part. They will not see any bone. They will not see any. There will be activity in the circulation of the body, but mainly it will localize to the kidney part. So it can study the filtration rate of the kidney by using the such a tracers, or whether how many nephrons in the kidney are functioning. That also we can quantify. No any study other than this gamma camera can quantify the function of the nephrons. Okay, so gamma camera detects the rays and that forms image. That image can be either 2D or XY, the 2D planar image, or it can be a 3D image, or we call it as a SPECT image. So this image represents the physiological function, and it also represents the size and shape of the kidney or organ, but it can represent the physiological function of the that particular organ. Okay. Now the mostly used isotope in SPECT study or gamma camera study is a technetium-99m. So technetium-99m we can obtain it from the generator. So generator are kept in a hot lab of the nuclear department, nuclear medicine department, and from the hot lab the generator is being eluted daily to get the activity. So we call it a 99MO and technetium. So 99MO decays to technetium-99m as a metastable state with a half-life of 66 hours, and 99M Tc decays with a 6-hour half-life and 140 keV photon energy to 99 Tc. Okay, so daily after 24 hours, we can elute it. So elution process starts once you receive isotope or generator for today. So you can use it for next 10 to 15 days, depending on the activity what we have got. So molybdenum technetium, the transient equilibrium is responsible for that is being used to get this generator eluted daily. So transient equilibrium is that when the two isotopes, our parent isotope has not very longer half-life than the daughter isotope. So molybdenum 99 has a 66-hour half-life, and technetium is a 6-hour half-life. They are very nearby. So that's a condition of the transient equilibrium. And at equilibrium, after 24 hours, we can, after 4 half-life, you can say 6 into 4. So 24 hours, we can again elute the generator. We can get the technetium for that particular day. And this technetium is being tagged with the different isotopes. Different pharmaceuticals. As I told you, for each organ, one pharmaceutical is responsible. Okay. So the route of administration of this radioactivity. So when in a hot lab, these two are labeled together. Once in a hot lab, when these the isotope and the pharmaceutical, they are labeled together. They can be injected as a intravenous. The radioactivity is injected by through vein. It can be injected subcutaneous. In some studies, nuclear medicine studies, these isotopes can be injected subcutaneous, very near to the skin, or under skin also can be injected, and the studies can be done. The same isotope, radiopharmaceutical, can be inhaled. There are instruments available to generate the aerosols. So for lung studies, these aerosols are important. So these radioactive substances are being inhaled by the patient, and lung studies can be performed. And there are some isotopes which are given administered orally, or it is called the ingestion. The route is called as the ingestion. So radioactive substances can be administered orally with the water. So now, how do you measure the activity? So for measurement of activity, there is an isotope calibrator. That instrument one should have in the hot lab. How we measure the activity? So once you elevate the generator, so total activity in a saline you get, say around in 10 ml, you have 50 millicurie of the activity. So once you keep the vial of 50 millicurie in this is like a well chamber of our brachytherapy dosimetry. It is similar. It has similar principle. Only the calibration factors are already implemented in that, and it gives direct reading of the activity. So once you put the isotope in that particular well, you will find the what is the amount of activity is available for that particular day. Say out of 50 millicurie, what you get in the morning. So if you require only 3 millicurie for one particular study, or thyroid function studies are being carried out with a 3 to 5 millicurie of the technetium 99M, then only that part can be taken out and it can be given to the patient as a IV. Okay. What are the pharmaceuticals? Pharmaceuticals are the chemical molecules which determine the behavior of the radio pharmaceutical in the body, and they are tagged with the isotopes. Like technetium-99, why this isotope is very peculiar in nuclear medicine? Because it has a +7 valency or oxidation state. So it can tag with the different molecules, chemical molecules. Like MTP is used for bone study, DTPA and DMSA are used for kidney study, microalbumin particles are used for lung studies. HIDA, HIDA is basically used for liver studies. So these are the different pharmaceuticals, and same isotope is being tagged with these chemicals. Because of this +7 valency, it can easily be tagged with these molecules and can be administered to the patient. Even the new technique, the PET-CT and PET-CT, it uses two different isotopes. One is the 18F FDG or 68 gallium. So there are gallium generator also available, by which you can do the PSM studies or DOTA test studies in the PET scan. So if you see the figure here, the radioactive compound is linked to the target molecule and target proteins, and it localized to the particular organ or particular cancer cells. So radiation emitted from the body, then once it is administered, the radiation emitted from the body is detected by the gamma camera. So the radionuclide property, the 99 TC, why it is being chosen for the nuclear medicine purpose? Why not any other isotope? Because it emits only gamma radiation. The energy is 140 keV. It allows detection by the gamma camera. It has a very short half-life. So technetium-99 is a 6-hour half-life, and iodine has an 8-day half-life. These are the mostly used in diagnostic part. Because of the shorter half-life of technetium, say I have done one study today and I have to do one more study tomorrow. So within 24 hours, it can decay 4 times. So that activity will be very negligible in the body. Then we can have such a shorter half-life is required for the isotope to be used under gamma camera. It is also available readily, and production cost is also less for the technetium-99M. At the laboratory also, we can generate this isotope. So, which are isotope, they are directly affecting or directly get absorbed in a particular organ. So, technetium-99M, the isotope, it has half-life 6 hours. It can target the salivary gland. The target gland will be salivary gland or thyroid gland. It can accumulate to bones. it can have blood, liver, lung, and heart. So those all studies can be performed with technetium 19 mm. Iodine mostly used for the thyroid because our thyroid gland produces T3, T4, TSH hormones. So those hormones, production of those hormones, the iodine is basically required. The 131 iodine. The gland doesn't differentiate between the stable iodine and radioactive iodine. And gallium is mostly used for the tumors or inflammation studies. That particular isotope can be used. So the other isotopes are being used for a therapy purpose, the P32 and strontium. So that we'll see in a later part. Okay, so this basically equipment is called as a gamma camera. It has a collimator, the main purpose. It has a sodium iodide crystal. It has a photomultiplier tubes, and then electronics for preamplifier, positioning circuit, pulse side analyzer, and data analysis software are available. The gamma camera can be of a single head or a dual head. Mostly nowadays, the dual head gamma cameras are being used. You can perform the spec studies either on a single head camera or dual head camera. Both camera you can have the spec studies available. It's not that only with the dual head we can do the spec studies. Under a single head gamma camera also we can do the spec studies. Dual head camera helps to have the faster acquisition than the single head. It has a double or a half time it takes for the acquisition. Like suppose I want to do the bone studies. So bone studies we need to do anterior and posterior. Then in this two-head camera, you can have the both acquisitions at the same time. If you have single head camera, you need to acquire anterior part first and then posterior part. And nowadays the SPECT or gamma camera also comes along with the CT part. So earlier the images were it was very difficult to diagnose from the images. So now there is a CT part has been added like a SPECT CT or PET CT. So CT component is added to have the precise diagnosis or precise location of the disease. So gamma camera is an electronic device used in medical diagnosis for imaging and distribution, imaging the distribution of radioactive compounds in the organs or tissue once the patient is injected. Imaging the gamma rays emitted from the radioactive compounds present in the body. Okay, the one part, the collimator, is very important. We have our LINAC is equipped with the multi-leaf collimator. So the same way you can think of this gamma camera collimator. So what it does, if you see the figure, these are the septums. These are made of lead are being used for the parallel hole or collimator, making the collimator purpose. So if you see in the second figure, the gamma rays which are coming from the patient, only those will be allowed towards the crystal. Okay, only in the state of the gamma rays which are passing from the collimator, and they can interact only those who are traveling parallel to the collimator, they only can interact at the crystal level. So this parallel hole collimator plays an important role of the nuclear medicine imaging. If you don't have the collimator, and if you try to image directly, you won't be able to image any particular. You will acquire the image, but you won't be able to diagnose the disease because you will get the photons from all directions. So to avoid the direction of the photons which are not coming from parallel view, so they will be avoided by the use of the collimator. So again, this collimator is made of lead. It maintains the quality of the image, like a resolution of the image, you can say. The spaces between holes is called as a septum. So septum avoids the rays coming from the you can say from an angular entry. The collimator consists of the series of holes of a lead plate. It can be used to select the direction of the rays falling on the crystal. So collimators are of four types: the parallel hole collimator, pinhole collimator, diverging collimator, and converging collimator. Like in our MLC multi-leaf collimator, we have a single plane. Okay, and they are making the shape of the target. But this way, there are different collimators are available, and as per the energy, also we have different collimation to be used for the gamma camera. Suppose I'm using a technetium 99M, then I will use a low energy high resolution collimator. If I am using iodine for imaging, then I will use high energy high resolution collimator. or high energy low resolution collimator. Okay, so these are the collimator are a very important part of the gamma camera detector assembly. Okay, so this way low energy high sensitivity, low energy all purpose, low energy high resolution, high energy all purpose also, these are the different types of collimators are being removed and attached to the gamma camera to get the proper image. Now, image is formed on by a crystal, or it is called as the scintillation process. When gamma usually made up of sodium iodide crystal, and it is doped with the thallium. Sodium iodide with the thallium doping is the crystal is used. Okay, like our EPID. In EPID also amorphous silicon is used. The same way here the sodium iodide thallium is being used. The main function is to convert the gamma photons or gamma rays to the visible light. The process is called as scintillation. The light intensity is proportional to the gamma energy. The scintillation is a transparent material, okay, and it is basically for the energy lost by ionization. It can be detected. The higher conversion, if it has higher conversion efficiency, it has a shorter decay time to the excited state and transparent to its own emission, and high detection efficiency. It is hygroscopic and rugged, and it is inexpensive. Okay, so the optical characteristics of the sodium iodide crystal, it has a density around 3.67. It has a maximum emission of a 415 Newton meter energy. It has a light yield of around 38,000 per MeV. The decay time is very low, 250 nanoseconds. Effective atomic number is 50, and it is hygroscopic, but so it must be sealed properly. Okay, so the thickness of this crystal, the scintillation sodium iodide crystal, is around 0.9 centimeter or 9 to 10 mm. It is thick, and above the scintillator there are photomultiplier tubes. The PM we call it the PMT. So a array of around 37 to 91 photomultiplier tubes is being used to form the image. Okay, the pure sodium iodide crystal. If you take a very pure sodium iodide crystal, it is scintillator at the liquid nitrogen temperature. But with the thallium doping only, it can have the scintillation properties at the room temperature. So these are the different crystals. Earlier, for a gamma camera was being used. The most then you can see the properties of the sodium iodide thallium doping. So decay time is very low if you compare with the other crystals. Photon yield is also very high. That is 38 per keV. Number of photons can be formed. And but it is only thing is it is hygroscopic, so it needs to be properly sealed. So mainly all the gamma cameras are nowadays are having sodium iodide with the thallium doping crystal. Okay, see in the image you will see from body the photons are getting emitted. So those photons are passing from the collimator. Either you have low energy all-purpose or parallel or collimator, and those photons will directly interact with the sodium iodide crystal. So once the crystal at the process of the at the level of the crystal, the scintillation process will happen, and light photons will be emitted. So those light photons will be detected by the photomultiplier tube. The photomolecular tubes has a multiple anodes, PMT you can call, which in turn attracts the large group of electrons and which are converted to the electrical pulses. So the same way the patients will be lying, and we have collimator, then scintillator, then photomultiplier tube, and then other electronics and computers are there to get the proper image. So this way, on a light photon get incident from a light photon coming from scintillator. Incident photon interacts with the scintillator. Scintillator gives off the light photon, and those light photons falls on the photomultiplier tube and at the focusing curve. And that from that focusing, there is a multiplication of the electrons, and at the anode, the image this signal will be captured. Okay, so gamma camera may contain around 37 to 91 photomultiplier tubes attached at the crystal above the crystal. It detects and amplifies the electrons that are produced by the photocathode. The photocathode, when simulated by light photons, ejects the electron. only very small amount of light is given off from the scintillator detector. Only one electron is generated for every 7 to 10 photons incident on the photocathode. So this description you can get it from anywhere. So these signals are converted to digital data. Then computer reconstruct the image like a 3D or reconstruction processes. It can produce 2D image with a background. So multiple 2D images can be reconstructed to get the 3D images. Similar concept of the CBCT. Okay, and but the source is the photon, light photon coming from the patient body. Now come to nuclear medicine studies. So as I told you, the thyroid scan can be performed by iodine and can be performed by the technetium. So the amount of activity, you can see the amount of activity given for the technetium scan or thyroid scan is around 3 to 5 millicurie. While the same thyroid, if you want to image by radioiodine, so you give the activity in terms of microcuries, around 10 to 50 microcurie, because the iodine takes some more time to get it uptake at the thyroid level, and so we administer very slow amount of activity, and as it has a half life is also 8 days. So thyroid uptake is studies are being done by technetium and iodine both. Imaging, if you give the iodine, we have to image after 24 hours, because immediately once you take swallow the iodine is given orally, and once you swallow it, it goes in a circulation, and it takes time around 24 hours to get it collected at the thyroid level. The counts are the uptake is being calculated. How much uptake of the iodine takes place, or how much uptake of the technetium takes place in the thyroid. So how we do it? As I told you, in the in the dose calibrator, you measure the activity, pre-syringe activity or counts. Then we inject it to the patient, and post-syringe take a count again. So you will come to know how many counts we have injected, or how much activity we have injected to the patient. So out of that, how much activity, there will be uptake in the particular organ, and that uptake will be quantified. Along with the background counts will be subtracted, and you calculate the uptake. So in the image, if you see, so background neck is seen with some counts. So we take a background, and we have the injected activity. We know the pre-syringe and post-syringe counts. So we know the injected activity. We get the total uptake. So around 30 to 50% is the uptake in the thyroid gland of the radioiodine or of the technetium, a normal thyroid gland. Okay. So, and what are the different imaging protocols available on the gamma camera, either single head or dual head? You can have the static imaging like this thyroid study. You can have dynamic imaging for the kidney studies. You have gated imaging like our RPM gating. We call it, there is a gated imaging also possible. For the heart studies, the gated imaging also possible. And we have whole body imaging. So these are the 4 imaging protocols that are generally performed on a gamma camera. The static for thyroid, dynamic for kidney purpose, gated for lung, gated for the ECG gating. They call it the ECG gating. So ECG, basically ECG electrocardiogram is performed for can be performed for every patient, and ECG can be used as a trigger. Like our DIBH studies gated, we use the RPM, the respiratory motion. The same way for the heart cardiac study, the gating is given by the, or trigger is given by the ECG. Okay, and we have the whole body imaging, like in a PET or a whole body bone scan imaging. These are the 4 modalities, 4 way of the imaging is available for gamma camera. So if you see this image, one image is of the bone scan, as I told you, the whole body with a single injection, you can have the whole body imaging. Okay, and even this is a heart perfusion studies. The myocardial perfusion can be studied using the particular isotope. So cardiac functions are 2. One is the cardiac Muga studies or a perfusion scan. Perfusion scan studies the wall of the heart or the LAD and the arteries can be perfusion scan can be done, and we can have the function of the heart. So that is called as the Muga studies. So recently in last week only for a DNB studies, DNB exams, this Muga scan was asked. What is a Muga scan? So just it is one of application of the gamma camera. In renal scan, we have DTP and DMSA. So activity inject is around 5 millicurie. For bone scan, whole body bone scan, the activity MDP is injected. Radioactivity technetium 19 nm tagged with the MDP around 20 millicurie is injected. The liver scan around 3 to 5 millicurie. For lung scan also around 5 to 7 millicurie of the activity is being administered. Okay. So common nuclear studies, we have planar imaging and 3D imaging. So neurological studies are being done. Oncology studies are being done. I will not go in details of this. Okay, renal studies, cardiac studies, as I told you, the pulmonary function studies, for orthopedics, all studies are being done. Okay. Now, what is a SPECT? As I told you, the gamma camera can be of a single head or dual head. So it is a single photon emission computerized tomography. It is one of a mode of a gamma camera to acquire the image in a 3D fashion. So generally it acquires a planar image, but when you acquire a 3D like our CBCT, so CBCT we can have 2D also, KV or a CBCT imaging. The same way you can think of a gamma camera acquiring single 2D image or a CBCT like CBCT image or 3D image that we call as a SPECT image. Okay, it is mostly used for a cardiac study, brain imaging, or tumor detection. In bone scan also it can be used. And it has a SPECT and CT part. So all two gantries are combined together. One is the SPECT gantry or gamma camera gantry along with the CT gantry. And this machine is called as a PET CT or equipment called as a PET CT. And we are using the PET imaging and CT imaging. Both are combined together. So there are two gantries. Okay. And there is a concept of the standardized uptake value in a PET scan. Okay, that is not for the gamma camera, it is for the PET scan. Now we can go for the PET scan. So PET scan has a positron emission tomography and computed tomography both together. Okay, and we use these SUV values is mostly being for radiation oncology. We are very interested in SUV values. We'll discuss that. So PET scan is a positron emission tomography. Now, from where do we get the positron? So positron is from 18F. So 18F fluorodeoxyglucose. So it is basically glucose scan in the body. It was developed late in 1970s and mostly used for the brain studies. Positron emission tomography, it is a medical imaging technology that enables us to view how organ system of the body or they are functioning at the cellular level. So here also you will see the radioactive isotope. They are linked together with a protein and they tagged with the cancer cells can be found in the body with the fluorodeoxyglucose. Okay. The workflow is injection of the FDG around 5 to 8 millicurie is being injected. So there is a waiting time of around 45 to 60 minutes for all PET studies. The whole body imaging is being performed. Images are reconstructed and SUV standard uptake value is being calculated. Again, the same principle for this calculation of the SUV, you also require how much activity you injected. So they take a syringe count, initial pre-syringe count, then they inject it, then we take a post-syringe count. We come to know how much is the activity injected to the body, then how much is the uptake in that particular organ, what is the BMI of that particular patient, the height and body weight. It gives the BMI, and from those we get the SUV calculation. So basic studies which are performed under PET are mainly in the prostate and whole body staging of the cancer disease. The PET detector is a different than that of the scintillator detector, but the principle is same. It has also photomultiplied tubes. Okay, the BGO crystal is being used, or LYSO. These crystals are used in a PET camera, and this is the principle of the PET. PMT is the same principle of the PMT works for the gamma camera, PET CT as well. Okay, these are the two crystals, the BGO and LSO or LYSO. These are being used. LYSO is mostly in Siemens equipment. You will find the LYSO crystal. It is a little expensive, but it has a very short light decay time. That's why we can have very lesser activity also can be injected. And there is a concept of the time of flight. So from where the photons are generated, it will be able to give you the idea of the time of flight. So we'll see that. So in another equipment, there is called as a gantry concept or ring concept. So we have a single ring gantry of the crystals, or two ring gantry, three ring gantry. That way, rings are also available. Okay, These are the different isotopes which are used in PET studies. This carbon 11, nitrogen, oxygen, or fluorine F18. So F18 is a production from O18. We have we have bombarded of the protons, and we have the 18F production of the 18F from the enriched water. Okay, you can see this reaction F18 that gives the O18 and one positive electron, or the positron is given. So this positron has a energy from zero point 0.6 to 0.6 MeV, around 0.6 MeV, or mean energy, and it ranges, it travels around 1 to 2 in the tissue, and then it gets annihilated. After annihilation, it produces two photons apart from each other at 180 degree each other, and those are imaged at the BGO or the LYSO crystals. Okay, the another isotope which is used in PET is a 68Ge germanium. We have germanium generator, or gallium generator, we call as a gallium generator. So that 68 gallium also being used for the PET studies. So this is the principle of the positron emission. The positron emission occurs when the isotope decays and a proton decays to the neutron. A positron and neutron is being emitted. After traveling a short distance around 3 to 5 or mostly 2 the positron emitted occurs an electron, encounters to an electron and gets annihilated, and it gives out two photons at 180 degree to each other, and that photon energy is 511 keV. Okay. Now, what are the factors that affect the SUV value? So, as we are interested in radiotherapy, what is the SUV value of that particular lesion? So that is depend on the blood glucose level of the patient, as it is FDG, fluorodeoxyglucose. So the patient, if it is very high level of the glucose, then we need to do some medication and then do the PET studies. Body weight, the time after injection, mostly 45 is the waiting time. Then extravasation of the syringe, that also can affect the SUV value. Okay, renal function also can affect the SUV values. Okay, these are the two scans. Okay, on left side you will see 18 FDG scan, and on right side you will see the gallium scan. If you see the background in the image, okay, this gallium is mostly used for the prostate studies, the PSMA studies. Okay, so if you see here, there is uptake in the prostate, and background uptake is very low, and it doesn't. This gallium doesn't accumulate to the brain, doesn't accumulate to the much in the circulation. So after some time, it gets washed out. Only it accumulates to the parotid glands, or submandibular gland, and kidney and bladder. On the other hand, the left side image, if you see, the FDG can accumulate to the brain also and bladder, and there is a very high background of the in the image, which restrict to the proper diagnosis. So FDG PET and DOTA PET. So these are the two examples. So one is a FDG is a metabolic imaging, and while gallium is a receptor imaging. So those are studies which are being performed on the PET. Now, what is PET and SPECT? So PET has emits positrons. It is gamma emission. It has a high resolution because of CT part. Both have the almost similar. It is a little costlier. Those things are. Okay, so this is when PET image, the PET scan which shows the metabolic activity. If you see FDG is accumulated in the tumor, and the same CT scan of the same patient, you get the proper depth of the tumor, and wherever we have to other organs or nearby organs also can be given. So primarily the PET scan are being used for a staging purpose. Okay, for treatment monitoring purpose. So we have pre-treatment and post-treatment PET scans are also available. Sometimes we need to fuse it in the planning system to get the idea how much is the disease progression or a disease whether disease relapse or whether there is no evidence of disease. So that way treatment monitoring, recurrence detection, okay, for biopsy guidance also the PET studies can be performed. So neurological studies also can be performed under PET. The cardiology studies, the myocardial or the myocardial perfusion studies also performed. Mostly for infection and inflammation, the gallium studies are preferred. Okay, we'll skip this. Now come to therapeutic part. So therapeutic part of the nuclear medicine mostly used these isotope is the iodine. So iodine can have a low dose and high dose therapy. So under low dose for normal condition, thyrotoxicosis or multinodular gut, we give very low doses. And for papillary carcinoma of thyroid, we treat with the radioiodine therapy. Now I have mentioned here MCT, the medullary carcinoma of thyroid. So we also treat on a LINAC, we treat thyroid gland, but that is only of the medullary carcinoma thyroid, not the papillary. So papillary is mostly treated with the iodine therapy, 131 iodine, and medullary carcinoma we can treat on a LINAC. So in a benign condition also, the thyroid, when the thyroid is over functioning, as overactive, the 131 iodine also given to reduce the function of the thyroid or to make the patient must have some complications. So not in cancer, but only for normal conditions of thyroid also can be treated with the radioiodine. Okay. In radioiodine therapy, most of the occupational that you can skip. This is the one very good handbook on for teachers and students from of IAEA. You can have refer that for further knowledge on that. These are some of the slides from I taken from that only. So 131 iodine emits the gamma photons of a 361 keV, and there is one guideline as the after administration of the activity, how much time it should be allowed for the pregnancy. So for P32 it is around 3 months. For iodine it is around 4 to 6 months. For strontium it is around 24 months. So these are the some of the slides I have taken from IEE. So these are the different isotopes which are of interest. Our interest is iodine 131 and P32. Even lutetium also therapy is being given, which are pure beta emitter. So P32, strontium, lutetium, they are pure beta emitter. So no need of a special precaution. Only spillage, radioactive spill happens or urine spills. Those we have to take safety. We have to take safety. However, the iodine we need a separate ward to get the patient admitted to the hydrotherapy ward for maybe depending on activity, maybe for 1 day or 2 day, depending on the activity, we administrate it. So biological half-life is one of other term. How much time the T effective and T physical and T biological. So that total gives the effective half-life. So, for example, a thyroid gland, how much is the uptake? Depending on the uptake only, we have the dosimetry of the dosimetry study. For example, 1 milligram of iodine, if you administer orally, it gives around 5 to 10 gray dose to the thyroid. Okay, with uptake of around 30 to 60%. On an average, if you see 50% uptake, so with 1 millicurie, there is around 5 to 10 gray of the dose is given to the thyroid with effective half-life of around 4 to 6 days, and with the thyroid gland mass is around 30 to 50 grams. Okay. So for a high dose therapy, we have the discharge limit of the 5 mR per hour. So internal dosimetry. So that is a very interesting part of the nuclear medicine where we administer the radioactivity orally and then activity goes into circulation. So under circulation, it will localize to the thyroid, we agree. But apart from localizing to thyroid, it has a circulation, during circulation, it gives a very high dose to the other parts as well, if they are not properly managed. Like if the patient is not fasting, suppose patient has some food and then you administer radioiodine, so it will stay more time in the stomach. So because of as it is staying in the stomach for a more time, it may deliver very high dose to the stomach. It can deal as it is excreted from the bladder. If the patient doesn't
More sir, you're not audible.
Oh, I thought my internet is gone.
नाही मला वाटतं त्यांचं हे गेलं वाटतं नेट
Exit
हॅज
झाले.
प्रॉब्लेम या एक्झिट झालं ते ही विल कम बॅक
Okay.
Hello.
yes
Hello,
you are
Amit?
audible yes you are audible now
Okay, okay. Yeah, there was some issue, I think network issue.
hmm.
Okay, so under safety of the nuclear medicine, so we have the same principle of the time, distance, and shielding. They are applicable. So spend minimum time with the
Melissa,
patient.
you need to share
So,
you need to share you need to share it
is it visible now?
एक minute yes now it's visible
Yeah. Yeah. Sorry for interruption. I think. Okay. So appropriate shielding material, it is mentioned under shielding. So why appropriate? Because for beta, you cannot use lead as a shielding. That is a, the brimstone radiation that occurs with the beta. So proper shielding is also required of the on the type of material which you are using for the diagnostic and therapy purpose. Okay. So under spill management, we have if it is very large volume spill, blood, urine, vomits, cover it spill with the absorption sheet. Immediately contact the facility radiation safety officer. Absorption pads should be thrown over the spill to prevent the further spread. People should not be involved. Many people should not be involved in the procedure. Only trained people should be available. The clothing can be removed. With the contamination skin has to be monitored properly. Should be decontamination room. You should have a spill kit available in the department. So these are the requirements of the our management of the decontamination or the radioactive spill management. If there is a contamination of the eyes, then there should be the eye washer should be available in one of room under the nuclear medicine facility. So this is the interesting that as I told you that one case was there. The patient was on dialysis. So we have to give the radioiodine therapy. So we have administered around 210 millicurie of the iodine, okay, orally, and dialysis also was performed during the study with the proper precautions. Only thing is that if the activity is going to remain in the body for a longer time, the bone marrow suppression also may happen for a patient. And the patient was given very high dose of 210 millicurie. So there was likely that, but somehow we could manage the dialysis part on time, and we could have the proper appropriate counts under bone marrow or the bone marrow cells. Okay, some of the shielding requirements in PET. So that can be, we have different hot lab available for a PET and for a gamma camera and PET. We have uptake rooms available. So uptake rooms risk requirements are different. We have scan rooms. The scan room requirements are different as we have CT and PET both together with 511 kV photons. We have waiting areas for the nuclear medicine for gamma camera patients and for nuclear PET CT patients. Okay, so mainly the high density concrete is being used with a wall thickness of around 200 mm. Okay, these are the shielding calculations are also nowadays available. So you can refer our normal shielding calculation formulas works. Only we need to have other than that, we should have floor covered with smooth, continuous, non-absorption surface because of the patient's vomits or patient's urine falls. Then we need to decontaminate properly. It covered the walls are to be covered. Okay. Okay. So under summary, we have these are the different isotopes which are being used. So you should at least remember which isotope is being for what purpose. So basically iodine and technetium, they are used under the gamma camera with those energy and half-life. They are under SPECT imaging or thyroid imaging, renal imaging, bone imaging, which isotopes are used under PET. So under PET, we have FDG, F18, and gallium-68. So these are the two isotopes we used. What are isotopes which are under therapy? So we have iodine, lutetium, yttrium, phosphor P32. These are different isotopes that are used in the therapeutic part. And under these SPECT and PET and SPECT studies, what are the detectors used? What is the energy? So that is very important. One should understand those. Okay, and there is a newer modality that is coming up. That is a PET with a different two isotopes. So one is FDG we can inject, and after some time we can inject a isotope with a beta and gamma emitter. So both can be detected by the detected by the detection system, and this is called as the multiplex PET. So that is MPET is coming in future. So we have to be we should understand what is the newer modalities that are coming in nuclear medicine. Okay, I hope I have made it within time, and thank you for giving the opportunity to discuss with this or discuss on nuclear medicine part. Hello.
Thank you, More sir. More sir, thank you. Thank you very much for
Yeah,
this
thank
excellent
you.
and informative lecture.
Thank you,
It was
Asari.
a actually very simple and practical explanation. Very nice, and I
Yes,
sincerely
I
appreciate
made it
your time.
simple for student.
Yes, yes, it is very simple. Yes, yes. Thank you once again. So, shall we start with some of the questions? I think so many of the questions has been answered, but still we will go through some of the questions which has not been answered. One was a question. I'll start with the last one. How to differentiate between major spill and minor spill?